Hello and welcome to this episode of HBCU. I'm your host, Dee Brown CEO, and joining me on the show today is a special guest, Dr. Victor Sutton. Dr. Sutton makes his way to the show via Jackson State University. Dr. Sutton, welcome to HBCU.
Thank you. Thank you for having me.
Man, the pleasure is all mine. Hey, I want to just always start this show off by trying to understand, how did you decide that you would go to Jackson State University? And I think, if I'm correct, you completed your PhD there.
That's correct. I'm actually from Mississippi, and growing up in Jackson, there was no other place to look at. I'm a big fan of all HBCUs. I have traveled and visited all of them. But growing up, watching the boom, going to programs on Jackson State campus as a youth, that was something that I always wanted to do.
So what was the experience like? Because obviously, undergraduate studies is one experience in terms of a collegiate experience. But what was that experience like completing your PhD at Jackson State?
It was very challenging. Going to HBCUs get you really ready for a number of different things. I finished up undergrad and I moved to New York, and I attended some certifications with the schools in New York, and then I got a chance to move back down south. And so I wasn't really thinking about graduate school at the time, but it just made sense. And so I looked around at different programs, and after I looked at different programs around, I actually fell in love with the program that was at Jackson State. And so that really what drew me there was just the quality of the programming, seeing what some of the graduates from the program were doing, and talking to some of the instructors prior to choosing a academic course. And the rigor was there, the quality was there, the preparation was there, and it was a great experience. It was a challenging experience and often frustrating at times, but that's part of it.
And since you've had both, the HBCU experience and then also the non-HBCU or PWI experience from an educational perspective, what are some of the differences that you notice between the two educational experiences?
I think that's a great question, sir. One is that there's a certain thing that when you're in a community and they understand and they get you, and I will say that there was a certain level of social connectedness. There was a certain level of embracing and embracement that you get. There was a certain level of warmth that was just really evident. And not to say that you can't get those from other universities and other non HBCU experiences. It was just, in my experience, it was just really, really evident. Having that embracing and having folks understand this is really, really important because of the number of PhDs that are underrepresented in so many disciplines. Yeah. And so understanding the mission, understanding the assignment, it really resonated when you're in these programs.
Now, I know you are a big supporter of JSU and JSU athletics. Just tell me, what is the experience like, just being part of homecoming and the festivities surrounding homecoming and the game, just from the JSU experience?
So it's really hard to communicate if you haven't lived it and haven't been a part of it. Just here, and I would just say it's just a testament. So I have colleagues, I have friends that went to PWIs, and they don't go to their homecomings. They look for and try to come to HBCU homecomings, not only just hours, but they travel to different homecomings. And I think there is a movement where they're trying to have more activities for targeted for minorities and African Americans in particular. A lot of PDIs to have a better experience at homecomings, and that movement is kind of going on.
Right.
But it pales in comparison to a JSU homecoming, because the activities for homecoming, they start at the beginning of the week. You have activities start Tuesday, and so homecoming goes that whole week, and there's something for everybody. And so we get to the point where my sister and her kids, they all come and stay with me during homecoming, because there's something for everyone and every age group, for something to do to have a good, festive and time around professionals, for the kids, just to have a great time. It's hard to explain, but it's quite the ordeal.
Yeah. So talk to me about during the process of going through your PhD program at Jackson State, were there any professors or staff members that were instrumental in you having a successful educational experience there?
Yeah, no doubt. There was a number of professionals and instructors that really wrapped your arms around you and promoted and pushed you as it relates to that getting that experience. Again, the rigor was challenging because they go above and beyond to understand with the knowledge that you're going to have to be sometimes a lot better than your counterparts in the same seat. And there's a recognition of that, and there's an expectation of excellence. And so there was a constant support from the instructors, and then we went in cohorts. And so you had a cohort and a team that traveled through the educational process with you. And so there was a lot of group dynamics. There was a lot of group learning, group study groups, and so forth and so on. So, it was just having that experience and raising the bar and the expectation to prepare a professional to go out into the community, to go out into the workforce and be extremely prepared to do what's going to be required.
So I want to kind of dive into your professional career, and I want to kind of take that journey to where you are today. So can you talk about, when you finished undergraduate studies, kind of what did you do from a career perspective, and then how did you work your way back and decide to do your PhD?
Great question. And so, sometimes you have your plans, and then sometimes God has His plans.
Right.
And so, and that tends to be a case with a lot of our careers. And so, when I finished up undergrad, I said, well, I think I want to. I know I need to get a master's, and got a call, and so I was able to get a fellowship, and so I thought I was going to be in community and economic development, and so that was going to be my track. I got a fellowship from HUD, and so I was doing a lot on the community economic development track, and so I got my master's, and so after that. I competed for a program that landed me in New York, and so I lived in Albany, New York, for 3 years. And while I was up there, I went to the Rockefeller Institute of Government and did some did public management there, and I enjoyed it. But to be quite honest, it was way too cold for me. It was a good time. It was a good time to get indoctrinated to a lot of other individuals, and just being away from home and a way of life of there. And I was working actually with the Department of Labor there. And so I enjoyed that, decided that I was going to make my way back down south. And at that point in time, everybody was going to Atlanta. And Atlanta was the hot spot, and that was it. And so I actually took a leave of absence from my job, and I went to Atlanta just to get a break, and I bartended at the U.S. Olympics. And the only night that I was off in that particular area just to get a break was the night that the bomb went off, if you can remember, in Atlanta. Yeah. And so after I kind of did that, I went back to New York, and I said, hey, it's going to be time for me to work my way back home. And so I started migrating and sharing some resumes and visas all around. And it just so happened that things happened for me quicker in Mississippi. And I ended up going into the nonprofit world, working with a couple foundations and working in the nonprofit sector. And so that went really well. And I said, well, I was doing that work. This would be a great time for me to work on my PhD. And so while I was working in the nonprofit arena, I started working on my PhD in public policy and administration. And so it took me some time to finish. And then from the public world, from the nonprofit world, I migrated to the public sector, working with the Department of Human Services and doing a number of different activities there. And just so happened, I found myself and having an opportunity with the Mississippi State Department of Health. And so I got my degree in public policy and administration from Jackson State University, which lend itself to what MBA is to the private sector, public policy is to the public sector and the nonprofit world. And it gave you those core skill sets of planning, organizing, reporting, staffing, budgeting. Really being a public manager, that was a skill set that you can take along to a number of different arenas. And so I started working in the public health field, and things really took off, and really excelled in that area, and really enjoyed doing the work. So I do a number of prevention programs and a number of grant writing programs.
So in your current role at the Mississippi Department of Health, talk about your role and responsibilities and how your work impact the communities that you all serve.
Thanks for that question. My current title is I'm the Chief of Community Health and Clinical Services at the Mississippi State Department of Health. So I oversee a huge amount of the operations of the health department. I work in conjunction with the state health officer, who is MD. But I'm over all the clinics in the state. We have a clinic in basically every county except for 2 where they're shared. And we're centralized, so I oversee all of those programs. I oversee all of programs in preventive health and health equity, which we have a number of programs in chronic disease, which would include cardiovascular health, diabetes, arthritis, and those risk factors associated with those issues, such as nutrition and physical activity. Of course, understanding that obesity underlines all of those things. Right. There's injury and prevention. That we have an area in that place, teenage pregnancy prevention. Also oversee a huge area called health services that has a number of different programs around breast and cervical cancer, maternal and child health issues, and an array of health services type programming. Also, recently, I'm the PI for what we call the Jackson Heart Study. And it's over a 20-year largest African American study in the country cohort, where I have a piece of that, which I established what we call a community engagement center. So I PI that, and that's funded through the National Institutes of Health. And so I have a broad range. I have great managers and kind of have authority over the state.
And you touched on a few things that I want to do just a little bit of a deeper dive into, because I think it would be important for our viewers to better understand some of the areas that you oversee and why they're so important, particularly to communities of color. One of the things you talked about was health equity. And I want you to really expand upon what that is and how that impact communities that are either impoverished or underserved from a medical perspective.
Well, that's a great point. And oftentimes, we as African Americans, we know that when some communities catch a cold, other communities catch the flu, and we're some of those communities, and it's been really, really historic about some of the issues and some of the challenges that we've had as a community. And not just our community, because I work with Vietnamese, I work with Hispanic and Latino as well, but primarily the largest demographic of minorities in this state are African Americans. And so there's a lot of historical factors, as we know, that cuts across what we call, oftentimes, I can tell you what kind of health you're in by looking at where you live, what you have access to as it relates to whether it's transportation or what have you, what kind of schools that you have access to, what you have access to by way of care and providing care, employment. So a lot of these issues around the social determinants of health, as it relates to factors around having the issues that we have in our community. financial issues, or as issues around redlining, and that we just historically have been discriminated against as far as economic opportunities and some of those issues. So looking at trying to level the field as it relates to access to care, as it relates to other factors as well, understanding that health is you're only as healthy as what you can afford and what you have access to. So in some communities, we still have communities where folks do all their shopping at the gas station, and what options are healthy there. And then there comes another issue as it relates what's affordable. Eating healthy isn't cheap, and in a lot of communities, before you can talk about eating healthy, you got to talk about eating. And so we understand those factors, and they're complex issues, and we're not going to just turn that around overnight, but it can be turned around. And so one of the things I did lead recently is that I did lead our COVID response for our state, which was unprecedented. And I say that because we achieved some semblance of equity around COVID vaccinations and COVID vaccine. And that was because we had strong community partnerships. But I say that in reference that if we can do it around COVID and get some kind of equity in that issue, we can do that in other issues if we prioritize those issues and understand that this should be a priority, and we're only as strong as our weakest link.
Right. And so you talked about the fact that you all have community health facilities in every county except for 2 in the state of Mississippi. And a lot of times people who may have access to health care with insurance and financial resources may not really understand the important role that community health facilities play within communities, especially for those that are living at or below the poverty line. Can you share with the viewers a little bit about your community health programs and how they help impact the communities they serve?
Great question, and we do a lot of things in partnership, and so the health department is more considered as a stopgap. If you're in a place that has adequate access and folks are seeing the doctor and those kind of things, then great. Go to your primary care physician, because we don't want folks using the emergency room as a way. We want you to go and get your annual checkup. We want you to work upstream as it relates to preventive services. So I want to get to that's where a lot of my background and a lot of my effort has been, is working upstream for those that don't have diabetes, or those that don't have high blood pressure. We want to get to you and look at behavior change type activities, working at an early age to create a healthier environment, healthier behaviors, so you can prevent or delay some of these issues. For folks that have some of these issues, we want you to control it. If you have high blood pressure, or if you have diabetes, we want you to control those issues before those issues get out of hand. For teenage mothers, we want you to understand about contraception and what are your choices for family planning type issues. And if you do have a baby, what are some of those issues you can to ensure a healthy baby and a healthy mom. And so we have a number of different programs to kind of support young mothers and young babies. We have a number of partnerships in place with providers, that folks that if you go in and someone give you a diagnosis of diabetes, or that you're pre-diabetic, then what are some of your options of what you need to do? There's programs and that we have in place. And what we also say, Dee, is that we have evidence-based programs. These are evidence-based programs. Is just a way of saying that we know that these programs work. We have evidence to say that these programs work if you would take advantage of them. So we have a number of different programs across the state that are with healthy aging, and we work with faith-based organizations. We work with community-based organizations. We work with work sites. We work with our schools. So we work and understand and try to, incorporate health into all that we do, where we live, work, play, and worship, right, and provide those opportunities. So there's a number of different things that we do as far as healthier eating, community gardens, prevention programs, what we call shared use agreements, where you're not in Mississippi is a rural state, and you might often have gyms and workout facilities in your community, but you have schools, and oftentimes those schools have tracks, and and having safe places to walk and exercise and those kind of groups. Working, understanding that a lot of working with barbershops. We have a statewide barbershop program, understanding that in our community, barbershops have been places where we used to go and you have men to go and hang out all day.
Right.
And then when you get like us and you have no need to go to a barbershop, we still have sons, and we have other folks that
Right.
and family that still go to barbershops, and you have a long trusting relationship. And so we work with our barbers to target some of our hardest folks to reach, and that's African American men. Understanding that African American men, oftentimes, they do not go to the doctor unless there's a problem. And so working with barbershops has been a really great gateway into the community, and getting men to talk about these issues, get blood pressure checks. And then we also have a lot of challenges around mental health, which has often been taboo in various communities, especially with our men.
Right. One of the things you said I wanted to just touch on real quick, because I don't know that a lot of people are really aware of this who don't have the or any reason to do this, but in a lot of impoverished communities, the population use the emergency room for their health care because they don't have the co-pays and the money to go to the primary care physician, and so they flood the emergency rooms for just ordinary routine care because they don't have the ability to pay for doctors. And you can go to an emergency room in a impoverished community and then go to one in an affluent community, and you can see that it's a significant difference on the wait time and the number of people that are there looking for service. So I just wanted to point that out. And then I wanted to, as we start to wind the show down, I want you just to touch on for me, how do you feel your educational experience at Jackson State University, how did it prepare you for the role that you're in today?
Great question. I give all kudos to my preparation at my HBCU, Jackson State University, the I love. What they prepared me in doing is really engaging with the community. So outside of the work that we had to do, that was, if you will, from the book and from the guideline, we were required to do community service activities. We were required to work on various opportunities and various things, whether that's feeding the homeless, whether that's taking a site visit at a community-based organization that may have done work with expungement, that may have done work with economic and community development, that may have done work with financial literacy, that may have done work in various health or mental health programs. And so I think it really broadens up your world and then understanding that connectivity. So my HBCU, outside of giving me a fantastic degree that I will put up against anybody and any university in the country, it also it went beyond the book, and we were required to do real life type activities.
Right, and that's important. I think in any educational experience, you have the fundamentals, the book knowledge, but it's nothing like that hands-on experience, and I think everyone should have community service. Before we close the show out, I do want to take a moment to, number one, thank you for being on the show, but I want to also award you with our HBCU Lifetime Achievement Award, and this is for your continued commitment to historically Black colleges and universities, and also for the success that you have had in your professional career. And so once again, I want to thank you so much for being on the show and taking time out your busy schedule to share your story with my viewers. And to my viewers, I want to thank you for watching this episode of HBCU. I'm your host, Dee Brown CEO. Thank you for tuning in, and remember, without you, there's no me.